Okay, ready, Angela? Hi, this is Dr. Jason Coleman. I want to refresh your memory on a few skills with the AED since you just got those AEDs in your stores. So, a couple of quick points. The AED does not tell you whether the victim has a pulse or not. It only identifies two heart rhythms, ventricular fibrillation and ventricular tachycardia. So it does not tell you whether you have a pulse or not. When you get these off the wall, when you open up that handle, an alarm will sound. It's important that other team members alert you to whether somebody is potentially down and not breathing so you can arrive with the AED. Now, the AED, there's 4 universal steps to the operation of the AED. The first step is we turn it on. The next step is we attach the electrodes. The third step is we clear the victim to analyze. The fourth step is shock and indicate. Now, we can use the AED on adults, children, and infants. Adults, children, and infants. Now, if it's an adult victim, this is important. Adults for AED usage are considered 8 years old and older. 8 years old and older. Children are 1 to 8, infants newborn to 1. If we use this on an adult victim, we use adult electrodes only. Adult electrodes only. If it's a child victim, our first choice is pediatric electrodes. However, if pediatric electrodes are not available, we can use adult electrodes as long as the pads are not touching. There has to be a gap between the pads. If it is an infant victim, our first choice is a manual device. You won't have those out in the general public. Those are reserved for hospital settings, for example. The second choice for an infant would be pediatric electrodes. The last choice would be adult electrodes, and we would have to use an anterior and posterior placement of the electrodes on the infant victim. Now, this is critical. If it is a child or infant victim, we always do 2 minutes of CPR first before even attaching the electrodes because children and infants usually go into respiratory arrest first. So they won't need the defibrillator. All right. Now, there are some special circumstances with the use of the defib. So when we use the defib, if the victim, the chest must be bared, so male or female, chest must be bared. If the victim is wet or in freestanding water, we need to dry their chest off first, remove them from any water source, or if they're on a metal surface like a metal loading dock, we have to remove them. If I'm kneeling on a loading dock, pressing the shock button, what happens to me? I'm going to get shocked. If they have a medication patch on their chest, which is going to interfere with your pad placement, we want to make sure that the pad or that medication patch is removed, wipe them dry, then attach the electrodes. Internal devices like internal pacemaker, defib devices, that's not a contraindication to the use of the device. We just want to place the pads an inch or so lateral to those devices, not directly on top. If you have a victim that has a really hairy chest, there's a possibility that the pads will not make a good skin-to-pad contact, in which case, if the machine's properly maintained, there should be a razor in here, a set of gloves, and a rescue mask. Shave the victim down, then attach the electrodes. If you've already attached the electrodes and the machine tells you attach electrodes, try pressing down the electrodes first. If it still says attach electrodes, make sure the leads are in. If you're still having a problem, rip the pads off, take as much hair as you can, shave the victim down, then attach fresh electrodes. Now, ideally, we want to set up the unit on the left-hand side of the victim. So if your partner is doing CPR and you arrive, you've called 911, and you have arrived with the AED, we're going to set it up on the left-hand side of the victim. And the first step, remember, was to turn it on, right? So we're going to turn on the unit. So on the unit, there is, it doesn't matter what brand you're using, they all operate the same. There's an on-off button. So we're going to turn it on.
Call for help now. Remove all clothing from patient's
Now, the
chest.
second step is to open up the electrodes, and we're going to look at the pictures on the electrodes. And these should be very easy to see. We're going to place the pads just like the pictures show us. One's going to go into the left armpit. One's going to go right below the right clavicle.
Look at pictures on pads.
So once the pads are connected, the machine's going to say we're ready to analyze.
Do not touch patient. Evaluating heart rhythm.
Now here's a critical step. If it detects one of those two heart rhythms, it's going to load with energy. We're going to shock the victim. Nobody can be touching the victim. So you're, as the operator of the AED, I make sure nobody's touching the victim. I'm clear, you're clear, everyone's clear. I press the shock button. Then we're going to go right back into our CPR, chest compressions and ventilations. The machine will automatically count down 2 minutes for us and reanalyze. Any questions? Once again,
Do not touch patient.
once again, the machine is only going to identify 2 heart rhythms, ventricular fibrillation or ventricular tachycardia. Don't be afraid to use the machines when indicated. It's not going to shock anybody that doesn't need to be shocked unless maybe grandma's holding grandpa's hand. So you want to make sure everybody is clear. Okay? Now, this is Dr. Jason Coleman. If you have any questions, feel free to reach out to me at 760-519-4689, or you can email me through drcoleman.com, Kullmann, or you can get in touch with your store manager. Thanks again. All right, thanks, Angela.